Ladies and gentlemen, welcome to It's Rainmaking Time. This is Kim Greenhouse. It's a pleasure and an honor to welcome Sally Pacholok, RN, BSN today. She is the co-author of a blockbuster book that you all must buy and read called Could It Be B12? An Epidemic of Misdiagnoses, the underground classic that has saved lives. It's out in its second edition. You are going to be shocked at how B12 deficiency is impacting a myriad of symptoms, diseases, and how quickly and efficiently and cheaply these diseases and symptoms could be taken out of our lives. You will not believe what you hear. Sally is an RN who has been an emergency nurse, worked at the ER for many, many years, along with her husband. She is going to talk to us today about why it is that most of us should be tested for B12 deficiency, the complexities of B12 metabolism, how it is that most doctors and hospitals that should be testing for it don't and are not necessarily receptive to this new knowledge. Ladies and gentlemen, welcome Sally Pacholok to It's Rainmaking Time. Good morning.
Thank you for having me.
The first thing I want you to lay out for us is why is it that B12 is not utilized more prevalently in our supplementation and diets?
The problem regarding B12 deficiency amongst physicians and healthcare institutions is there is a knowledge deficit. There's poor or absent screening in symptomatic and at-risk patients. Our current range for what a normal serum B12 level extends far too low. And there are lack of other sensitive tests to aid in diagnosis when indicated. And most clinicians are waiting for enlarged red blood cells or macrocytic anemia to be present, which does not need to be present to think of B12 deficiency. And elderly are frequently misdiagnosed due to increased incidence of their pre-existing diseases and comorbid conditions. We're miserly with B12 treatment. We have poor protocols, substandard care, and most physicians are treating a lab report versus the patient. We're diagnosing patients late, following old guidelines, and we have incomplete information. So the number one reason is there is a knowledge deficit in the medical and healthcare community regarding B12 deficiency, which is absurd because this disorder has been known for over a century. In 1934, we won the Nobel Prize in Medicine for the discovery of vitamin B12 to cure pernicious anemia or B12 deficiency. Why, 7 decades later, we're failing and actually injuring people has to stop. And that's exactly why I wrote the book in 2005, and we updated the edition in 2011.
How did you, as an emergency nurse, become interested in this subject?
Well, long story. I've been practicing emergency nursing now for 24 years, but I've worked in the emergency room actually for 28 years. I was a paramedic at first. While I was going to nursing school, I was lucky that I was actually macrocytic, meaning I had enlarged red blood cells, but I was never anemic. Long story short, I turned out that I have a B12 deficiency, and there's several reasons why you can have a B12 deficiency, but the particular type that I have is called autoimmune pernicious anemia. And I was so young when I had it, I was like 20, they actually call it juvenile autoimmune pernicious anemia. But when I would show physicians my blood work, they'd say, don't worry about it, eat more vegetables because you can have enlarged blood cells, red blood cells, if you have a folic acid deficiency or B12. Folic acid is all in the vegetables, fruits, grains. B12 is in animal products. So they were wrong with that. But as time went on, I really didn't have severe symptoms. I was tired, but I was going to college and working. But when I had a surgery, I had told one of the physicians the surgeon that I had, let me back up. I had one of the physicians actually test me because when I had a lab book that described how you diagnose different macrocytic problems, he did do particular tests. I did a Schilling's test back in the day. They did a serum B12, and I was very deficient. So he told me that you have a B12 deficiency. My grandfather had pernicious anemia, almost died in the 1960s from it, and so I was on B12. 2 years later, I had to have a surgery, and I told my surgeon that I had pernicious anemia, and she said that can't be. Have you ever seen a hematologist, a blood specialist? I said no. Sent me on my way. This was like 1985, 86. And this hematologist spent a lot of time with me, did a whole bunch of tests on me, and told me that there's no way that you have pernicious anemia. You're way too young, that clinically you don't have it, da-da-da-da. And so I argued with him, and so he said, fine, I'm going to do all these tests on you to prove that you do not have this. You need to stop taking your B12 injections because you don't need them. Well, sure enough, 10 days later I get a call. They want to see me in the office. He was going to call me and give me my results over the phone. So I went in there, and lo and behold, I took my chart off the door. Back in the 80s, they used to put the charts on the door.
Right.
I had my history, what he wrote about me, and he made me sound like I was some kind of a, hysterical young female, or I was imagining things I didn't have. He comes in, takes the chart out of my hands, and says, oh my goodness, you are the youngest person I've ever seen with B12 deficiency. And that kind of, he really took interest and started, palpating my liver and my spleen and really looking at me. And I remember leaving that day thinking, if I wouldn't have argued with him, and I thought, how could he have missed such an easy diagnosis? I mean, he had the blood work in front of him. And when I went to see him, I was already on B12 injections for 2 years. So he completely dismissed the signs, the symptoms, my history, the risk factors, etc. And so that this long story led me into curiosity of how many other people is this happening to. But at the same time, I was working in the emergency room. So when I was going back to school for more nursing classes, getting my bachelor's degree, when I would see patients coming in that were symptomatic of B12 deficiency, I would try to educate my colleagues, et cetera, and they would laugh and go, B12 deficiency, have them go take a pill, and they'd kind of roll their eyes. Nobody would test the patient. And it wasn't just emergency personnel. It was their internists, general practitioners, specialists, because people come into the emergency room, and, when we work in the emergency room, we have the greatest opportunity to witness the frequent misdiagnosis because we are caring for many other physicians' patients, and we see a greater volume and wider variety of patients than any other, doctor and nurse. And we're not limited to a specific group of patients regarding to disease, body system, age, or sex as our other healthcare providers. So when I would see this, that's what led me to be very frustrated. We know that B12 deficiency is very common in older adults over the age of 60. And what was really getting me was that these patients had many symptoms of B12 deficiency or had risk factors. And when I would go to them and see, did anybody, we go through the computer, look if they've ever been tested. They never were tested or screened for it. And then you'd ask the physician or their other specialists that would come down to write orders if they're being admitted, and they would not test them. So twofold, I had the disease process which really made me dive into what B12 deficiency pernicious anemia was, and I realized it doesn't just happen to older adults. And then my frustration as a healthcare professional working in the field, witnessing the group that they felt it was very predominant in, they refused to test, let alone any other age that was symptomatic. So the combination of knowing so much about B12 deficiency to protect my own self, and even my previous experience where I had a seasoned hematologist tell me that you didn't have it, where he was completely mistaken, and then finding supporting articles that this does happen to younger people, and then witnessing where they won't test people led to this huge frustration and feeling I had to do something for the people. I decided to write a book to help protect the public, inform the public, and protect themselves, and to become informed and get tested. And that's where this kind of all began.
Apparently, the doctors that have read your book are so impressed with the massive amounts of research and factual information and the relational information. I'm telling you, it's one of the most comprehensive whole systems approaches to understanding the role of B12. The way that you've written the book is really great, I have to tell you. Really?
I think the reason I kind of wrote it that way, I always feel like for 20 years, I've been advocating and trying to educate people about B12 deficiency, and I kind of feel like I had to actually write like an attorney, like to write it like I had to defend what I'm saying. So it's backed up with hundreds of